Well, the European meeting is an update of what's going on in urology now at this moment in time, and it's of course a very big meeting, more than 10,000 people, clinicians attending this meeting, and so all the fields of urology are being covered, and so for the general urologists from Europe and in fact from all over the world, because there are a lot of people from outside Europe coming attending this meeting more and more, you have a good overview of what's now the ongoing in urology, and I think this is the big advantage of this big meeting. Of course, it's a big meeting, so for very specialized things, it's not the optimal meeting. There you have the very dedicated meetings that are organized in other meetings. Compared to other meetings like the AUA, the SIU, this is more European approach, and so that's I think a bit of difference. Well, there's certainly, if you are looking at oncology, well, there are so many simultaneous things ongoing. The advantage here is that there are no, that you have the plenary session and then you have only poster sessions, so you can walk from one poster room to the other poster room and try to get some information out of it. But it is difficult, of course, because if you have a couple of simultaneous poster sessions, you have to walk from one room to the other. And that's sometimes difficult to interact with presenters to see what is the relevance of the study, and so that can be difficult. Well, it's a little bit early because it's only the second day, and still some topics to be addressed. But concerning oncology, because I especially followed the oncological topics on prostate and bladder cancer. For prostate cancer, I think imaging was one of the things that had a lot of attention. So that's something that people can take home. What's the role of MRI? What's the role of new imaging like PSMA, PET scan, and those kind of things. The other issue is we more and more, due to the imaging, we detect more and more early metastatic disease, so-called oligometastatic disease. And there was a good session about that, and I think this is something that people take home. And especially the question that came up during this meeting is what should we do now? Because everybody is now, many people are now thinking, okay, we see one metastatic lesion, okay, we should operate that, we should radiate that, but the evidence of that is very small, very meager at this moment. So that was one of the good things. Well, for medical students, it's a little bit difficult because that's mainly organized at the local bodies, so national bodies. And so these societies do not have so much influence there, because there are regulatory bodies for instance in the Netherlands, where you have to say, okay, what should be covered during the medical training of the students, and you have to deal with that. And the difficult point of that is because we are now. I'm now in the field of. I'm one of the people who is now changing the bachelor training program for medical students in the Netherlands in our university, and if you see what is being part on oncology, and then I just say oncology. And that's not urology, because urology is only a very minor topic in that. I'm a little bit concerned, let's say concerned, that they will have a very good basis for the next steps. So what the societies could do is give a signal, but that should be a universal signal, not only the urological societies, but also the medical oncology and the radiation oncology, to give signals to that the training should be on oncology, because it's still killer number one. That this should be that this should have good attention during the training of the medical students, because it's getting more and more difficult. It's not the way I was trained. It was just we have a diagnosis and we have a treatment, and now you have to know everything about it. It's not only surgery anymore, and that was also echoed here in this meeting, that the urologists of the future should have good knowledge about medical treatment. And it's not only medication, it is cytotoxic treatment, it's immunotherapy and all those kind of things. So the basis should be good for that. Well, that's I think they have a very crucial role, because if I look at how we do it in the Netherlands, it's a real evidence-based medicine, evidence-based guidelines. So we make questions, and then the epidemiologist is searching all the literature and excludes what's not good and includes what's good, and then we have to make the grade of recommendations. And so it's very important to not only for the urologists in this case, to help them what kind of treatment is the best, but also the healthcare system, the healthcare providers, they look at these guidelines, and if we state in the guidelines, okay, this medication is indicated for this stage of disease, well, that's a level 1 evidence and a grade A recommendation. Well, then the healthcare providers have to do something with that. So it's very important. But as I said before already, all these studies have been done in a very selected group of patients. And for the future it will be quite different, because you have to individualize your treatment. And so you have to look at many more. We have a lot of exclusion criteria for the trials, and if the patient is sitting in front of you, you have to deal with all these things of this patient, and then you say, okay, that's why we give this or that. But they have a very important task in having the possibility to give the treatment or doing the investigation, and also to prevent over-diagnosis. That's also very important. Well, what I much enjoyed is that being active in urology in a university clinic, and being involved in many bodies, the EAU, the Guidelines Committee, you have a lot of communication with people all over the world. You learn a lot of people, but you learn all different systems, and you learn about different approaches. You learn about so many things, and that helps you to interpret a lot of what has been published. You can put things in perspective, and this can help you again in training your residents, and help to guide them, and to interpret all the things that have been published. And I think this was one of the rewarding things of the past years. Yeah.